In this video, we will talk about policies and procedures. What are they, their development and updation, as well as their termination. For more videos, visit my Facebook page, Healthcare Quality. A policy is a simple statement representing the official stand of the organization regarding a specific issue. Examples: our hospital had adopted a policy of defining, protecting, and promoting patients' and customers' rights. Our hospital encouraging customers to express their comments, suggestions, and complaints, while the procedure is the steps to be followed in implementing a certain policy. It should be written in simple and easy to understand language. Policies are divided into administrative policies and procedures, APP, refer to the policy and the associated procedures that will be applied consistently throughout the hospital and all its affiliated facilities. Departmental policies and procedures, DPP, are intended to help employees understand how certain issues are handled in their own department. DPPs are written to meet the needs of a department and must not contradict with any general APP. Now we come to the steps in policy and procedure development, review, and revision. Determine whether or not a policy needs to be developed or it already exists. If already exists, determine the needs to review and revise, that's to say, as due after 2 years or as needed to improve the process. Create process flow chart to illustrate the procedures. Brainstorm with the users who will be affected by the process. Test the validity of the process and modify if necessary. Write the policies and procedures using the following format and get the signatures of all concerned. The contents include the following subheaders: department name, policy number, effective date, revision date, pages X of Y, title, description, statement of purpose, definitions, policy, procedure, equipments and forms, related references, and finally approvals. Head of department will send finalized policies and procedures to quality department for review, reviewing numbering, forms, and contradicting policies. Then the quality department will forward the subject policy and procedure hard copies to medical and hospital directors for approval. Head of department returns approved policies and procedures to the department. Make duplicate copies to be placed in another folder and to be submitted to the quality department for filing and monitoring. The original copy to be kept in the department for employees' reference. Head of department is also responsible to communicate the policy and procedure to the employees of the department for their information and compliance, and place a copy of the administrative policies and procedures in the department policy and procedure manual for employees reference also. He assigns employees to maintain the policy and procedure manual for proper handling and use at any time. Department head is responsible to review policy biannually. The review shall be directed towards assessing the accuracy and applicability of the policies and procedures, and adapt each policy to the actual performance. Policy termination shall be implemented once a revised version is approved in effect, and is usually done by shredding. Thank you.